Open up the Senate Appropriations Human Development Subcommittee, and thank everyone for being here early. And if we could get the President Pro Tem open us up in prayer, appreciate that. You're on number 13.
Be happy to, Mr. Chairman. Mr. Chairman, I wanted to thank you and your committee members and the Appropriations Chair and the Budget Committee, the Budget staff for being here early. You guys are getting the Early Bird Award this year. But I very much appreciate everyone's initiative to get this process underway. Let's go to the Lord in prayer. Our Heavenly Father, we ask that you give us guidance and discernment and judgment as we go about making decisions that are going to affect so many million Georgians. We realize, Lord, that you have entrusted us with an awesome responsibility. We don't take that responsibility lightly. Lord, we thank you for your grace, your mercy, and your love. It's in your holy and precious name we pray. Amen.
Thank you, Mr. Pro Tem. Let's just do a few House rules here. I should say Senate rules, shouldn't I? Absolutely. That was not a faux pas. That was meant that generally from a housekeeping rules there. No, but we very much appreciate the House moving through the amended budget quickly, and in light of the pandemic with COVID-19, this subcommittee of human development will have the Dbhdd, Human Services, Division of Family and Children's Services, Public Health, Veteran Services, and Vocational Rehab. Today we'll be covering that, and we have a hard stop at 7:30 this morning because someone else will be in this room. And members who are attending via Zoom, let me remind them that if they would text us, we'll be happy to answer their questions. That's the way we're going to handle that. If they would text...
they can send it via Zoom and I'll grab it.
Okay. Thank you. The chairman of the Appropriations Committee reminds me that they can send it via Zoom, and we will ask the question for them. So we're going to have, if we have time at the very end, we will have public comment. We're doing things socially distanced. And let me just remind everybody, mask and distance and good hygiene, as we should be doing all during this time, and encouragement of the vaccination, of which I was a participant of the Moderna vaccine study, and they broke the label, and I got my 2 vaccines back in the summer. And my ears did not fall off, and my hair is still in place, so I'm here. Excuse me, he has not gotten his vaccine yet. So anyway, so let's get started. If we could have Department of Behavior Health and Developmental Disabilities, we'll get started with them, and then we'll go with Human Services and DFACS and Public Health and Veterans and Vocational Rehab.
Great.
They are on Zoom, and on for those who are here, thank you, Commissioner Fitzgerald. The floor is yours. Good morning.
Excellent. Thank you, Chairman Watson, Chairman Tillery, and all the members that are present via Zoom this morning. Let me just get a sound check and make sure that you can hear me. Excellent. Very good. Well, I should say good early morning. I appreciate someone who can tell jokes at 6:30 in the morning. So thank you for the start and the opportunity to be with you all. And I do want to start as Senator Miller did, just with a note of gratitude for the Senate budget staff, who have been helpful throughout the pandemic, and certainly leading us up to the ability to do a virtual presentation this morning. So we do appreciate the partnership. Melody, Caitlin, thank you all very much. So with that, I will begin our very brief presentation this morning of the amended fiscal year 21 for the Department of Behavioral Health and Developmental Disabilities. Just a reminder for your new members, the Department of Behavioral Health and Developmental Disabilities is the public safety net for individuals with mental illness, substance use disorders, and intellectual and developmental disabilities. And how we do our work is through our 5 state hospitals and a network of over 700 community-based providers. So with that, Chris, would you move to the next slide? Thank you. So you may recall during the joint appropriations hearing, I spoke at length about the impact of COVID-19 on the individuals we serve, our provider network, their staff, and in fact, our system capacity as a whole. The pandemic required dramatic changes to the way we both deliver services and pay for services. And all throughout, our focus has been, how do we continue to serve Georgia's most vulnerable citizens? And what it required was a great deal of flexibilities, especially with an eye towards keeping crisis services available and accessible to individuals in need. So what you see here, I won't go through all of these, but in item number 2 are several examples of the strategies that we deployed to keep the safety net operational. And I really just want to call out 2 of those strategies. The first one, the final bullet in item number 2, was the staff augmentation that we received. Want to acknowledge the support of the governor's office and OPB across our 5 state hospitals. This staff augmentation from Jackson Healthcare has been a vital lifeline to keep our hospitals open with quarantine units, isolation units, and a continued ability to serve. It's really been critical. The second tool that I want to mention is what we've talked about before, the enhanced FMAP. This has been critical to our service delivery. You all know that Medicaid is a state and federal partnership. The FMAP is the amount essentially that the state pays in this partnership. Usually for Georgia, that's around 33%. In light of the public health emergency, the feds presented a new formula to the states, giving us an additional 6.2% of those FMAP dollars back to the states so we could use those dollars to navigate the pandemic. And so that term enhanced FMAP becomes really important. It has been a vital lifeline. It continues to be as we are still greatly impacted by the pandemic. So Chris, next slide, please. Okay, so here are the amended fiscal year 21 budget changes for Dbhdd. As you can see in item number 1, in both the governor's budget and the House budget, Dbhdd is being directed to continue to use these enhanced FMAP dollars to provide services perhaps in a different way. One, to keep crisis services in place, use telehealth, provide in-home services, perhaps where we used to do group services, all of these things that allow the safety net to remain operational and to allow those providers, many of whom are small businesses, to stay in business so that we know they will be there to provide services as we come out of the pandemic. So it's a continuation and a utilization of those enhanced FMAP dollars. In item number 2, you see that the governor's budget called for a feasibility study related to an IDD BHCC. The House proposed an actual implementation of the IDD BHCC once again by using those enhanced FMAP dollars. Let me take just a moment, remind you what an IDD BHCC is. A BHCC is a behavioral health crisis center. We have many of these around the states, and they are an essential element of our crisis continuum. We do not have any that are equipped to serve individuals with intellectual and developmental disabilities. This would be a first of its kind. This has been a growing need in our state, and it's a gap in our crisis continuum. So you see the proposal there for us to proceed with implementation and construction, essentially, of an IDD BHCC. Item number 4, once again, a reference to utilizing those enhanced FMAP dollars. In this case, it's for Southwest State Hospital in Thomasville and Northwest Hospital in Rome. So I have mentioned our 5 state hospitals. Those are the 5 that are actually serving patients. These two are hospital campuses that are closed. We no longer provide services to patients in those hospitals. Dbhdd's role in these hospitals is that we maintain the campus. This is really important. State Properties intends to sell both of these campuses. In order to do that, the campuses have many old buildings and property, and that has to be adequately maintained for sale. So again, we're using those enhanced FMAP dollars in order to maintain those campuses. The final item that you see here is House addition. You may recall that you all generously supported the building of a 40-bed forensic unit to begin to meet some of our increased demand in the state to serve forensic patients. We have built the 40-bed unit at our hospital in Columbus. The House proposes now that we delay the startup of that unit by 1 month, which would yield that $860,000 figure that you see there. It is still our plan that we would open the unit this fiscal year, but those dollars would be reflected back with that delay. So those are our 5 items in the amended budget. We've tried to be as brief as we can this morning in the interest of time, but I am more than happy to answer any questions about any of these items or anything else.
Thank you, Commissioner Fitzgerald. I certainly appreciate what you do and what your BHDD does for the state of Georgia, being the safety net. It's exciting that with the behavioral crisis for individuals with intellectual and developmental disabilities, that's brand new, first in the nation, cutting edge, and we certainly appreciate your leadership relating to that. And I understand we do not have any questions from the committee on Zoom, but we do have those in person. Senator Burke.
Good morning, Commissioner. Thank you for your report today, and continued thanks for all the work you do for Georgians. The Southwestern State Hospital, I've seen news reports that there's been an agreement to sell that property. Do y'all have a timeline on when that actually might happen? I know there's some steps that have to be gone through, so just curious if there's a timeline on that. Thank you.
Yeah, thank you so much for the question, Senator Burke. Here's my understanding. Again, the sale of the property is in the hands of State Properties Commission, but it is our understanding that there is an offer in place and that we are in a 90-day due diligence process. So we will wait for that to play out. We are continuing to maintain the campus. I'm not sure if other steps need to be taken after that, but that is an active process in Thomasville.
That's good news. We do have a question from a member from Zoom, and Chairman Tillery has that.
Hey, Commissioner. There we go. Commissioner, there you have one question online. It's from Senator Orrock. What is the impact of delaying the onlining of the forensic beds?
Yeah, thank you for the question, Senator Orrock. We're hopeful that the delay really will not impact our ability to open that this fiscal year. What we will do is just pause on the hiring and training, but we build in some time so that we can do that in a thoughtful way. And given the pandemic, that we imagine doing that process in steps. So we hope that it will not impact actually being able to serve individuals in that unit, just a slowing of the hiring and training process.
And we have now, was it over 600 forensic beds now in the state of Georgia? Is it something like that?
Yes, located throughout all of our hospitals.
Right. Thank you so much. I think that has the questions answered. So let's move on. And thank you so much for being here with us via Zoom.
Thanks for your support. We appreciate it.
So next up is Department of Human Services with Division of Family and Children's Services.
Good morning.
Good morning, Commissioner Crittenden. We certainly appreciate you being here. Thank you so much for what you do, and the floor is yours. Thanks so much.
Thank you. Good morning, Chairman Waxman, Chairman Tillery, and committee members. Thank you for this opportunity to come before you to discuss the governor's recommendations for the Department of Human Services amended fiscal year 2021 budget. My name is Robin Crittenden, and I'm the Commissioner of the Georgia Department of Human Services. Due to time constraints, I'm going to quickly walk through my presentation and point to the applicable lines in the Senate tracking sheet. As of March 23rd, the majority of our workforce transitioned to working remotely. Child support customers are directed to self-service options for conducting business with the department. And in the event we are unable to resolve a customer inquiry remotely, some staff see customers in person. Both Adult Protective Services and Public Guardianship staff have also continued to provide their services. In this new environment, productivity is stable and all employees have the required equipment to work from home. There has been no disruption in services and frontline staff have received proper PPE. Looking at our total budget for state fiscal year 2021, DHS has about $1.6 billion allocated to protect and serve Georgia's vulnerable populations. When you add the budgets of our attached entities, the total for the department's fiscal year 2021 budget allocation is $1.8 billion. Now we will look at the amended fiscal year 2021 budget recommendations for DHS. Overall, for DHS, the governor has recommended an amended fiscal year 2021 budget of $800.4 million in state funds. This amounts to an increase in expenditures of $4.4 million. The House passed an amended fiscal year 2021 budget of $800.2 million in state funds, which includes an increase in expenditures of $4.2 million. Now, turning to pages 14 and 17 of the Senate tracking document, line item 177.1, for amended fiscal year 2021, the House made one change to the governor's recommendations, a reduction of $208,000 realized in savings from vacant child support services agent positions. The savings occur from employee turnover. This happens when a position is vacated until the time the position is filled. For departmental administration, the governor is recommending on line 180.1 a reduction of $537,000 to reflect the 6.2% increase of the Enhanced Federal Medical Assistance Percentage, or EFMAP, during the COVID-19 public health emergency, as described by Commissioner Fitzgerald a minute ago. On line item 180.2, also for departmental administration, the governor has recommended $4 million to begin implementation of the Patients First Act, which was passed by the legislature in the 2019 session. The Department of Human Services is responsible for the gateway system that will serve as the centerpiece for the program. Line 180.4, the governor's final recommendation in this program is an increase of $1.3 million for the Georgia Gateway Cloud Migration implementation. Now, turning to page 19 of the tracking document, line item 182.1, the House recommended to add language recognizing the continued use of Families First Coronavirus Response Act and CARES Act federal stimulus funds to support older adults, adults with disabilities, family caregivers, and the Ombudsman program in response to the COVID-19 pandemic. The Georgia Vocational Rehabilitation Agency, Council on Aging, Family Connection Partnership, and Safe Harbor for Sexually Exploited Children Fund Commission are attached to DHS for administrative purposes only. Their budgets are on pages 26 through 30 of the tracking document. Questions concerning their budgets should be directed to their leadership. This concludes the recommendations for the Department of Human Services amended fiscal year 2021 budget. I'm happy to answer any questions you may have at this time, and thank you for the opportunity to come and address you today.
Thank you, Commissioner Crittenden. Certainly appreciate that. I don't think we have any questions via Zoom, any panel questions. Thank you. Thank you so much. You did a great job early in the morning, and we certainly appreciate that.
Thank you very much.
Now we have Director Rawlings in person, so that's much appreciated. Thank you for getting here early. Traffic was very good, this morning. Let me get your podium mic on. I apologize. Would you test that?
Test.
Yes.
All
Okay.
right.
Thank you so much.
Very glad to be with you all in person this morning. It may be early. Well, not for you doctors who've been through residency, perhaps, or for Chairman Tillery, who's always up at 5 o'clock in the morning. But I am reminded that right now there are probably several of our workers right now going home from being at the hospital all night, from putting a child in a foster placement, from dealing with a young adult, a youth in our care who may be having some issues. So it's really, I'm proud to represent. Speaking of the COVID vaccine, both Chris Hempflin and I are doing the Novavax Trials ourselves. So far, well, he looks a little funny, but I think so far we've had no ill effects. Very briefly, the story of DFACS this year is we have, over the last really 2.5 years, 3 years, reduced the number of children in foster care by about 25%, which I think is a good thing. What we're trying to do is empower our frontline workers to do what is necessary to keep children in the community, to work with local churches and nonprofits and service providers to keep children safe, so that we've actually, you'll see we've got some cost savings from that as well, which means we can redirect those funds to actual services for those families. Certainly at the same time increasing the number of adoptions. We've increased those to about 1,400 per year, which has been a significant increase, but also means we need to be using more funds to pay adoption assistance, because our children who come out of foster care adoption are often special needs. They qualify for a number of benefits, certainly. I think on the eligibility side, the story, of course, is that we have dramatically increased the number of, both the number of folks on food stamps, of course, especially this past year. We've issued about $3.5 billion during the COVID period in food stamps and what we call pandemic food stamps. And certainly with about 35% increase in the caseload at some points. And then we have, of course, the PEBT program we've done in conjunction with the Department of Education, which has, and we're continuing to implement this, providing some funds for those families who had to pay for lunches when their children should have been getting the free and reduced lunches at school. So we'll go through the chart, the tracking sheet briefly. Page 12, which is the second page of, well, page 12 of the document. We're here in adoption services 174.1. Commissioner Fitzgerald very succinctly outlined what how we're benefiting in terms of federal funds from the increased 6.2% increase to FMAP participation by the feds. And so we're simply recognizing that thanks to the growth in adoptions, we will probably be here asking you for more funds in Amended 21 for adoption assistance, but for that increased federal percentage, so it's a net zero. We will continue going to the 178 Child Welfare Services on page 15 of the tracking sheet. the House made a couple of small changes here, reducing slightly about $266,000 to recognize that we had a little bit of delays in hiring some folks. As you can imagine, it's a little bit more difficult hiring during the COVID period. And then we're glad to see that they decided to add back some funds to our friends at MAC, Multi-Agency Alliance for Children. They run a great program to really increase graduation rates and educational success rates for our young adults, our youth and young adults who are still with us up to age 21. 178.3. Just really a recognition that we are continuing to receive, and in fact, in the COVID relief budgets from the feds, really some increased funds for community services, block grants for low-income heating assistance, and that sort of assistance that we'll be working with net zero, but it's just a recognition. Going on to page 17. We are in 180, which is departmental administration. So you'll see that this is really a recognition of some savings, again, from FMAP. This 180.3 actually combines with another issue. So as we needed to find $412,000 to pay for the additional EBT cards that we have to use for the additional folks who are receiving SNAP during this period. There's a charge for each of those cards. It's kind of a one-time charge, but we were able to shift some funds out of home care because we've reduced reliance on that to handle this. Continuing on down the budget, make sure I don't miss a page. My CFO is incredibly good at dog-earing pages for me. Going to page 22, what we call federal eligibility benefit services, in other words, SNAP, Medicaid, TANF eligibility. You'll see that 185.1, we have essentially, this is really an accounting switch. We've always, at one point, the Office of State Administrative Hearings, which hears the appeals for Medicaid and, for example, Medicaid and SNAP cases where folks are denied. One time that was independently funded. Now it's more of a business situation where we actually pay the costs of that, sort of in a contract. So the budget recognizes the reality there by adding $750 for that. You also heard Commissioner Crittenden mention that we'll start implementing the Patients First Act. We expect to add about 50,000 individuals to the the medical assistance rolls. We're going to start implementing that this year, and of course we'll need additional personnel services and that sort of thing to the tune of $707,000 to do that work. And then, again, a zero net, but simply recognizing in 185.3 our use of federal funds for the Emergency Food Assistance Program, which, as you can imagine, the food banks have especially are doing a lot of work during this time period. So we're doing all we can to help them. Next page, 23, in out-of-home care. As I've mentioned, as we said earlier, thanks to the increased federal participation, we've been able to reduce the amount of state funds for out-of-home care. And then that's about $2.245 million reduction. And then in 186.2, again, that's where we shifted those funds from out-of-home care to cover the cost of those EBT cards for our SNAP recipients. I believe we've got one more item, which is, again, as Commissioner Crittenden said, DFACS, which, of course, is the largest division of the Department of Human Services. We have just one of our great responsibilities, and we take it very seriously, is handling the Safe Harbor for Sexually Exploited Children Fund Commission. And we're very happy that, although there's some litigation still pending on that, some challenges from some adult establishments that don't like paying the fee, we do have about $650,000 or so in that fund, and we are able to begin allocating those funds to actually provide services for victims of human trafficking. And on perfect cue, that's the end of my presentation. I'll be happy to answer any questions.
We
you
do.
may
We have one online from Zoom, Commissioner Chairman Tillery.
Thank you, Chairman Watson. Just one question, actually, Director Rollins. Thank you for what you're doing. It looks like there's actually a little bit of savings because I know we went from having 15,000 children in our foster care program at one time to, thanks to your good work and the good work of many in your department, we've been able to reduce that down to, looks like, about 11,500 and actually create some savings in a good way because these children were able to be placed in permanent homes. If some of that savings was able to be included and kept in your budget, where would you suggest it go?
So, Chairman Taylor, you heard Commissioner Fitzgerald, for example, talk about gaps in in some of our mental health issues, and sort of the one gap we might have, you might say, in the same situation, is in ensuring you can imagine we have children who come into our system who have experienced severe trauma. We have children in our system who have severe mental health or autism issues. Sometimes they come into our system because of that. We're trying to avoid that. And so what we are working with y'all and the House and the Governor's Office, Lieutenant Governor's Office on, is a therapeutic foster care benefit that will be paid for by Medicaid, that will be accessible not only to children and youth in foster care, but also those children whose parents are just at wit's end and really need, we hope, sort of they're about to come into care if we don't get them some help. Therapeutic foster care is a very specialized therapeutic service, and it involving very highly trained foster parents who are also sort of a network, an integrated system of caring for these young people. And we are hoping to use some funds as we work with DCH and the Center for Medicaid and Medicare Services to actually get that benefit approved for Georgia. We'll obviously need some state funds to pull down that Medicaid leveraged federal dollars. We'll also need some funds to ensure that we are able to pay the room and board of cost of that. And so I think that's sort of the unknown, but I have been very grateful for the support of you especially, and Melody and Mike over here, and Lieutenant Governor's Office, and the Governor's Office, and everybody who's been very helpful to us and DCH in identifying this need. We don't have a price tag on it yet, but we think it's a very good use of our funds, and we anticipate that may be someplace we could do well by the people of Georgia too.
Thank you, Director Rollins. So that's a sort of a proactive look at foster care treatment, and that sounds very worthy from that perspective. Thank you so much. I don't think we have any other questions from Zoom. Anybody from the committee? If not, thank you so much for being here and for the great work that you do for our state. Thank you.
It was a pleasure, and I appreciate the chance to be here. See y'all.
Next up is Department of Public Health, Dr. Toomey.
Yeah, thank you so much. Can you hear me all right?
We can hear you well.
Perfect. Thanks so much, Mr. Chairman and committee. I have to say I'm not a surgeon like some of you are, and morning is not my best time, but it's still wonderful to be here with you today. And to go through the budget very quickly, I know in the interest of time, the slide deck includes a considerable number of additional slides with information about the vaccination program. And so even before I start, I just want to say that I will be very happy to meet with any of you individually or as a group to better explain the logistics and the ins and outs of exactly what we have done in our entire COVID response, including the vaccine program. Why don't we move to the first slide? And I just wanted to reiterate that our structure in the Department of Public Health is pretty much unlike any public health department in the country. We have the state office, which provides overall guidance and direction, led by the commissioner with staff to provide support and guidance to the public health districts. The districts are in fact state entities supervised by physician public health directors who report directly to me. But the 159 county boards of health, so really where the rubber meets the road, where the actual services are delivered, are independent entities, legally independent entities. And the health directors themselves serve in a dual role as CEO of the boards of health, but also as state employees. So it's unusual in that you have this dual kind of hybrid system, but also I think the pandemic has in some ways demonstrated the difficulty of ensuring consistency in every aspect of pandemic response, whether it's disease reporting, contact tracing, or vaccination scheduling across that many different independent entities. I want to say, most of all, we have worked so hard with the districts and the counties together in a way that I don't think I've ever seen in my many years in public health. And just to again say with gratitude how hard everyone has worked and will continue to be working in their commitment to this work. And to ensure that we have a consistent, strong response in all parts of Georgia. Next slide, please. I wanted to just take this moment to go over the amended budget as proposed and explain some of the items if there are any questions. One of the adds proposed by the House were 3 positions which will provide additional leadership at the state office and basically support that overarching leadership. One is a chief medical officer, which is really a very important position in my opinion, because I am the only physician, permanent physician in the state leadership. We have had people from CDC who've basically volunteered and come on thanks to the former CDC director. And their graciousness in giving us some additional capacity, but we don't have that internal capacity right now. A deputy commissioner to basically work along with the commissioner to provide additional leadership. I actually ended up tapping somebody from a district to functionally serve in that role right now. So I'm robbing a district of their leadership to be able to help me with the pandemic response, and a chief data officer to work to bring together and synthesize the data from all the different sources that we have and ensure we have consistency across the board. Again, one of the things unmasked by the pandemic is that we had many, many legacy systems, both for disease reporting and also for vaccine reporting. These legacy systems were very adequate pre-pandemic, or we thought they were, but given the magnitude of what we're doing now and the fact that we are dealing in orders of magnitude of cases and vaccines that we never ever dreamed of, the systems have functionally failed. And we have also added the providers that had never before worked with us directly in this way, including, frankly, hospitals. And we have nearly 2,000 providers right now, which is many times greater than had ever been involved with vaccine reporting. And I will again say that the legacy disease reporting systems have to amalgamate now, not only our current lab tests, the PCR test, but the multiple other lab tests and the surveillance in a way that actually maximally demonstrates our current outbreaks. And we had, for example, difficulty with the old systems to be able to even identify racial and ethnic changes in diversity in the cases. So these are some of the reasons the chief data officer, we believe, would be warranted, and appreciate the House's support for that. The Grady Regional Coordinating Center, it was something that was put in the budget by the legislature. We really have seen it be very important at a time when Grady was had the ruptured pipe, but it has been very important during the COVID response to ensure that ambulances can go to the counties and the hospitals where there is capacity, and this just makes the budget whole for this year. Under epidemiology, this is an estimate of based on a working group and a team that it would take to modernize, our disease surveillance system, including put in place the foundation for a new vaccine management system as well. I mean, I really see this as to me, what will be an important value, if anything, of the lessons learned in the pandemic. If we can improve our disease reporting response and vaccine reporting and coordination with providers, because we are working with legacy systems that simply don't have the capacity. Under the FMAP, we have a reimbursement as Commissioner Fitzgerald outlined. And so these, I think, are self-explanatory. And under infectious disease, this just brings our funded positions back to where they should have been when last year 2 positions in STD, HIV, and tuberculosis control were inadvertently reduced, and this puts them back in. And the additional budget add on the House side was for $15,442,591 for the ADAP program. That number actually came from an audit that I commissioned to look at the ADAP program and look at what I was told was going to be a shortfall. The AIDS Drug Assistance Program, as well as the HIV Insurance Continuation Program, provides HIV drugs to individuals with HIV who don't have the ability to pay for this treatment themselves. It's been extremely important over the years to be able to maintain individuals on treatment, and particularly important now, given the pandemic and the challenges we've seen with individuals losing their employment and potentially their insurance, and also being able to pay insurance premiums. And so this wasn't a number that was random, and it actually reflected an audit of the program. And this will take us to the next federal fiscal year for that program into March. Without that additional dollars, we'll be the only state that has a waiting list. And that on the next slide, and just very quickly, we have gotten a significant amount of federal grants for our response. And I just wanted to, again, outline that these federal grants are, number one, focused and somewhat limited in what they can be used for because they are federal, but also the time limited. And we're looking at how we can ensure that what comes out of this pandemic is some sustained infrastructure capacity in public health long term. But already about 25% of that $1 billion has been spent simply for the testing, because it pays for staff, it paid for contact tracers, it paid for many of the other responses that you saw at the district and county level, and much of it went out to the districts and counties, either in staff or grant and aid. And we anticipate a similar thing with the epidemiology and lab cares 3, and because that will also be providing our response to the importance of the vaccination program, as well as the vaccine specific funding. As well as continuing testing throughout the state, because you can't stop the testing, you have to continue those activities. And one final note, we are seeing almost 20 now cases of the variant virus. That, to me, that doesn't matter where they are. It tells me that given the fact that we're only sampling a small number of our total positives, that we have a high number probably spread throughout the state. And then we have to continue not only our prevention messages, but also importantly, our contact tracing, which is another investment that is paid for with these federal dollars. And there's many additional slides related to the vaccination program. I just want to say that as of this morning, when I checked it early, our total vaccination numbers were 836,518. And we have ramped up considerably, and so this is actually underreported. We have more, and we have ramped up considerably, and our limitation right now is simply availability of vaccine. Although we'll be getting a small amount more. The new administration said about 16% more, and with a regular cadence we can count on. The most important thing, though, is that the large amounts of vaccine that we had hoped for probably won't materialize until April. And so given that, we're going to have to continue to use this approach that identifies the highest risk individuals and move it in an incremental fashion, which I know is frustrating to the public. And I know how many constituents you've heard from, as have I. But let me stop there because I know time is short. There's a lot of other slides with information, and please let me know if I can call you or meet with you at some other time if there are any other questions about the specific programmatic response.
Thank you, Dr. Toomey. We do have a couple of questions from the panel. Dr. Kirkpatrick has a couple questions, then we'll follow with Dr. Burke.
Okay, thank you, Dr. Toomey, for everything that you're doing. I wanted to just hear a little bit more about the grits package and kind of how that fits into your plans for overall upgrade of your data surveillance system. And then, do you want me to stop there and let you answer that first?
Oh, no, go ahead. Why don't you do both, and maybe I can kind of answers.
And then the other question is, if we're able to do some moving money around from a bond package and things like that, any thoughts about shoring up the districts or the counties, if there's any extra money that we can find?
Okay, let me just say, I don't know exactly what you mean by shoring up the districts and counties. I mean, we're currently, grant and aid was not touched, and we are giving money to districts and counties, well, basically counties for response, for additional staff. All those contact tracers were purchased with the federal funds. I think that that's important, that little of this was spent at the state, or if it was for deployment to the districts and counties. So that's where the rubber meets the road. Okay. And that is where the actual responses occur, and we recognize this. And it's our role at the state to ensure that we're doing that in the most effective, efficient way. And that's why the data systems and the grits improvements are so essential, because right now we're not working in an optimal way. The estimate of 20 million was for the foundation and the implementation of the improved surveillance system, which includes the interface with laboratory reporting and as well as provider reporting and public-facing information sharing with much more granularity than we currently have, which I know has been a challenge. People interpret the fact that we don't report it, that we don't want to report it, when in fact we simply don't have that information. But that also will serve as the foundation and springboard to a plan we already have in place and generated by a working group, and have identified already a system that we have already some component parts to and could implement with some additional, in addition with some additional federal money. That new grid system, really by March, if not in its full capacity. And we don't want to just go cold turkey to a new system and leave providers having to relearn the system. What we would like to do is transition in a gradual way, automatically transfer providers, but make it easier for them to get their allocation, make it easier for them to see where their allocation is in the process. Right now, they have to call us and we have to look it up on a federal website to tell them when to expect vaccine and get all of us into a cadence that we can begin planning more in a more consistent way. And that those new systems, which at least parts of which are currently in use in other states, combined together will really make an improvement in our ability to respond to this pandemic, and will leave a legacy of response for future work of public health, regardless of pandemic or not, day-to-day public health activities.
Thank you so much, Dr. Toomey. That's so a improvement in the GRIT system for make it more robust, healthy, and to be able to communicate and improve the communication not only with the providers but with the folks at CDC and with you. So that is good news. And we have a question from Senator Burke, who is on number 3 mic.
Thank you, Dr. Toomey. And this is one that you can just send us, but if you haven't already, can we get the detail on the amount of the, not the amount, you mentioned the money of the grants, COVID grants that you had spent of the federal dollars. Can we get the detail on where those
Yes.
dollars have gone?
Yeah, absolutely. And let me ask, I know Lee Wright is on the call, and Lee, just send that breakdown. We have it all broken down. Those grants pay for contact tracers. We currently still have 1,600 contact tracers. We actually hired them at the state office because it was faster, and deployed them to the counties. So they're all over the state, the districts working all the counties. And we are working as many cases as we can. It's difficult because the numbers of cases right now are so high, but really focusing on these rapidly transmitting ones as a priority. And again, to note that the Budget Act included the foundation for both surveillance as well as the GRITS component, and we would, with a little extra of our federal dollars, we could do both, and the GRITS much more quickly.
Thank you so much. Good to hear that can be expedited and you're ready and prepared to do that. That's good. We do have a question from one of the committee members via Zoom. So Chairman Tillery has that.
Dr. Toomey, there's one question from Senator Orrock, which ties in pretty well to what you just answered. She asked, first of all, thank you for your leadership during this time, and also asked if you could update us on contact tracing. And are you are tracers working on cases here under the Gold Dome and elsewhere?
Thank you, Senator. I don't know about the Gold Dome. I haven't followed up on the specific cases. We are certainly working, but I'll get back to you on that. I'll find out for certain, and we are certainly working now on many cases. As I said, particularly these rapidly transmitting variants, because of the concern of the rapid transmission across the state. Because of the high numbers, it's difficult to have everyone contact trace. Everyone's contacted, but the contact tracing is difficult. But I will say that we will prioritize those individuals at highest risk who may be infected, and work around with higher risk individuals, for example, older individuals or individuals in nursing homes, and do contact tracing around there. Because having to limit because of the numbers of absolute cases. But I'll be happy to get back to you on the Gold Dome.
Thank you, Dr. Toomey. I think that we can go offline with Senator Orrock. I know the percentage positive rates throughout the state are high. I know that's over 10%. Under the Gold Dome, I think that's less than 1%, but we'll be happy to go offline with Senator Orrock and give her that information. Thank you so much for what you are doing for the state of Georgia. I know this has been trying times with the pandemic. Thank you very much. We're going to move on to, we're running short on time, so we have maybe best if if Director Roby will allow me to give a little bit of his report here, that there's a change from a Department of Veteran Service. There was only one change in the governor's budget to reflect the delayed start in the subacute therapy unit. This has been a big priority for the Senate, and we'll go, if we have any further questions relating to that or any question from Zoom or from our panel, we'll do that. Director Roby, is there anything to add to that? No, sir, I really appreciate you being here. I'm sorry we're having to limit that, but thank you so much. And if we can answer any questions anybody has immediately after the meeting, we'll be happy to do that. And we got some handouts for us, too. Thank you. Thank you. Certainly. Chairman Tillery has comments here.
Just to Commissioner, thank you first of all for being here. We do want to talk with you about that subacute care unit. You know that's been a huge priority of the Senate, and we'd love to see that come online as quickly as possible. Appreciate what you're doing, particularly in your war homes. Thank you so much.
Thank you so much. We appreciate the handout here and what you're doing. We are in a similar posture with the Department of Vocational Rehab with Chris Wells. You want to just, we got 2 minutes or maybe a minute and a half or less. We certainly appreciate that.
Be here out of brevity of time. Just wanted to kind of go over the presentation that was provided. I believe it should be on tracking pages 27 through 30. The presentation that you have there just basically consolidates the GVRA's consolidated presentation and budget. But the governor recommended no changes or a flat budget this year, which will definitely help in us being able to kind of move the agency in the direction and focus on some of the initiatives that we have there. We do have two changes from the House tracking, which was a reduction for one position. During this past year, money was restored for a director level position during the transition there. We didn't get an opportunity to bring that individual on until a few months into the fiscal year, so they're just capturing that savings. And then in our VR program, one of the things that we've seen during my time here is that it's been hard for us to change the model, which calls for us, our clients who has a barrier to employment is transportation. Our model right now has a lot of our clients coming into the offices for services. And the pandemic situation kind of elevates that particular concern. And so we're looking at how can we leverage technology. And so what we're trying to do is push towards a website or web-based platform to be able to allow parents, individuals that may or may want to take part in the VR program to not necessarily have to come into the office to apply for services there. So that is the change or the adjustment that you'll see at 197.1. Thank you.
Thank you. Appreciate that. Thank you for being brief. Still does not negate how important work that you do from a vocational rehabilitation standpoint. Thank you for what you do. I don't think we have any questions from the panel or from Zoom. If there's no further business, we'll end at 7:31. And thank you everybody for coming so early. And this concludes the subcommittee on Senate Appropriations for Human Development. Thank you.